The reopenings come the same week Wisconsin saw its largest one-day increase in coronavirus cases. Earlier, I talked with Governor Evers in our weekly one-on-one interview. And Governor, thank you so much for joining us again.
Thank you, Frederica. Appreciate it.
So it's actually now the second day in a row that we've seen the largest day-over-day increases in positive cases. It stands at 460 more cases reported today for a total now of 7,314 with 327 people who have died. How do these numbers bode for that 14-day downward trajectory required to reopen the state?
Well, we have to remember that 14-day downward trend is a number of positive cases divided by as a percentage of the total number of tests. So we are testing a lot more. Now, there's no question that, I think a couple of days ago, the percentage of positive tests were about 6 or 7%. Now they're 11 or 12%. So that is an increase in that percentage. But that is, I'm not a mathematician here on those numbers, but the bottom line is we were testing a lot of people in Brown County that worked in those meatpacking plants. And so the large number is a lot contributed to that. I won't say all, but a lot. But we're spending, we want to massively increase testing across the state. But at this point in time, because of that surge there, we are testing many people that have the virus.
I think I'm reading these numbers correctly from the Department of Health Services daily kind of tracking of these numbers. It looks like we're testing around 3,000 a day, and yet we have this capacity now of 11,000. Right. Why aren't we able to get up to that capacity that we have?
Well, several reasons. One is we're encouraging healthcare providers to do this. My goal is anybody that needs a test should have a test. I know that sounds like Donald Trump, but that is what we have to do. We do have enough testing materials. It's getting people tested, and we have enough lab capacity. So I think we had, I'm trying to think, almost 3,500 today. So we are ramping up. We've increased testing. We have plans all across the state. Northwest Wisconsin is going to have lots in the next couple of days, but so is the rest of the state. This is, I believe we can get to that 80,000 number in a hurry. We've been, focusing on Green Bay and some of the other areas where there's surges, and all those are disconcerting. And so, but it's important for us to have testing all across the state. We will do that. That has to be our goal.
In fact, you announced today that you're kind of branching out and doing community testing. Is that part of your effort to reach this capacity to do more testing?
Absolutely. For example, Pepin and I'm trying to think which other county in Northwest Wisconsin, Pepin and Buffalo County are having tests on May 1st. And yes, it's going to be community testing. If people feel that they want to be tested, they'll get tested. And so we're doing that all across the state. We've been kind of reactive, but I'm encouraging, and I've said this more times than I want, health professionals that are dealing with people, they should be encouraged, they should be ordering these tests. That is part of all of our jobs, to make sure we get as many people tested as possible.
You opened up more businesses to things like curbside pickups and reopened most state parks this week. Was this in response to criticism, or is it just time?
Yeah, we look all the time. I mean, we are constantly vigilant on what we can do next. And it's always weighing the risk and the transmission of a disease versus economics. And we're always doing that. So we felt confident that in the curbside work, actually, that the night from the day we asked it, I saw advertisements on TV for businesses advertising their curbside transactions. So in that case, we narrowed it down to one consumer or two consumers and one person from a store doing the work at the curbside. That seems logical. I mean, we can control virus transmission that way. So we're always looking for better ways to do it, and we'll continue to do that. We obviously have a stay-at-home thing until the end of the month, but we also will be looking till the end of the month.
How open are you to plans like those from the Wisconsin Manufacturers and Commerce, which kind of assign risks to individual businesses and where they are and how many cases there are in those places? How open are you to that plan?
Well, they have some that are parts of the plan that seem reasonable, but they also they did not include the public health side of things, and that is we need to drive down the number of viruses in the state, and the only way we can do that is testing, tracing, and having the proper appropriate equipment. That's what Donald Trump laid out for us, frankly, along with the CDC. So we're still following that, but I don't dismiss what they're doing. I'm just saying that there has to be a public health connection there.
Are you now working with Republican legislative leaders, the very same ones who took you to the Supreme Court to sue the administration over the extension of the stay-at-home orders? But are you working with them to kind of work something out here?
Well, I would say we're not in that position. Clearly, we had a plan, and their response to it was taking me to court, the Supreme Court. So now that's playing out, and who knows how that's going to work out. But I'd say if we rely on the facts and the law and precedent, we should win. But at the end of the day, if they have a plan, let's talk about it. And we keep them informed. My staff meet with his staff regularly. We've encouraged their staff to be part of our, be part of the center at Truax Field that we have with emergency management. So there's not that there's not communication going on. If they have a plan, I'll be glad to take a look at it.
All right, Governor Tony Evers, thank you very much for joining us.
Thanks, Frederica. Have a good day. Stay well.
You too.
Thanks.